Good afternoon. I'm joined, as you can see, by the Chief Medical Officer, and we will give you an update on the spread of Omicron in Scotland. We will also take the opportunity to reinforce the important request we are making of everyone just now to limit the number of contacts you're having in the run-up to Christmas, and indeed to stay at home as much as is feasible. Firstly, though, I will run through today's statistics. 4,336 positive cases were reported yesterday, which is a positivity rate of 10.1%. Public Health Scotland have made us aware that due to the larger volume of tests being processed, the turnaround time for results was slightly affected yesterday. This means that the number of tests being reported on today, and therefore possibly the number of positive cases, might be slightly lower than expected. I also want to repeat my plea to everyone: if you have symptoms of COVID or a positive LFD test, please do make sure you get a PCR test. 522 people are in hospital with COVID, 10 fewer than yesterday, and 33 people are in intensive care. That's one fewer than yesterday. Remember, though, there is always a lag between rising cases and rising numbers in hospital. And sadly, a further 7 deaths were reported in the past 24 hours, and that takes the total number of deaths under this daily definition to 9,771. And again, I want to convey my condolences to everyone who has been bereaved. In relation to the Omicron variant specifically, as of 5 p.m. yesterday, there were 696 confirmed cases in Scotland. However, these are cases confirmed through genomic sequencing, and this measure, therefore, very significantly underestimates the true volume of Omicron cases. As I have set out before, an earlier indicator of whether or not a case is Omicron and a better measure of the overall volume of cases is the absence in PCR results of a specific genetic characteristic known as the S gene. Around 95% of all tests that are done in Scotland are analysed in a way that allows us to see if this S gene is present or not. And this has revealed over the past couple of weeks that Omicron cases have been rising exponentially, indeed faster than anything experienced previously in the pandemic. And as you've heard me say, in recent days, cases have been doubling every 2 to 3 days. Now, last Friday, when I stood here, I reported that the S gene indicator was telling us then that 15.5% of all cases were likely to be the Omicron variant. Today, it is 51.4%. So that does mean Omicron has now replaced Delta as the dominant COVID strain circulating in Scotland. And that presents a challenge because we know Omicron is significantly more transmissible than Delta. It has an R number that is possibly above 4, and therefore it is driving, and the bigger the proportion of cases that are Omicron, the more it will drive, or the more it risks driving, a much steeper increase in cases overall. Indeed, cases have already increased in the past week by more than 40%, and we should expect to see that continue and indeed accelerate in the period ahead. The tsunami I warned about a week ago is now starting to hit us. However, and this is a key point, a really key point actually, we shouldn't be fatalistic about this. We are not powerless in the face of it, and I will return later to what we can all do now, individually and collectively, to slow down the spread of Omicron and try to avoid these worst fears that we have right now coming to pass. And slow it down we must, because there is no doubt that as of now, the scale and the immediacy of the challenge it presents is of profound concern. Even if it did turn out to be generally a little bit less severe for most people, and I want to stress again, we still don't know that to be true. For some people, even if that was true, it will still cause serious illness and hospitalisation, and tragically, more people will die. And even if the number of people falling seriously ill is a smaller percentage of cases than with Delta, the basic fact of arithmetic is inescapable. A smaller percentage of a much bigger number of infections will result in a massive number of cases needing hospital care. Indeed, total hospital admissions in Scotland in the week up to the 13th of December were slightly higher than in the week previous. So we're already starting to see an increase as a result of the relatively moderate rise in cases seen in previous weeks. Perhaps more significantly, in London right now, where the number of Omicron cases is currently the highest in the UK, hospital admissions are now rising quite sharply. If we don't act now, what we have feared all along since the very start of this pandemic, but so far managed to avoid the overwhelming of the NHS, could happen. And that is one, not the only, but it is one very important reason why slowing this down matters so much. But it is also important to understand that this is not simply an issue for the health service. The numbers of people becoming infected, even mildly, and having to isolate is already putting a significant strain on the economy and on other critical services. As people become infected, we lose drivers for trains, we lose teachers for classrooms, we lose nurses for hospital wards and workers for businesses, the length and breadth of the country. So there really isn't a choice to be made. There never has been, but right now there certainly is not a choice to be made between slowing the spread of Omicron and protecting the economy. We will actually only protect the economy if we slow the spread of the virus and reduce the number of people getting infected with it. That said, I realise, I am acutely aware that the steps we're asking people to take just now, particularly that advice to limit social contacts, is having a severe economic impact. This is particularly hard on sectors like hospitality and culture. These have been badly affected by previous waves of COVID and the restrictions we've all been living with. And of course, these sectors were hoping, until recently, with some justified optimism for a much better Christmas period ahead. So what has happened in the past 3 weeks has been a cruel blow to everybody, but it has really hit these sectors very hard all over again. That's why we in the Scottish Government have found £100 million to help businesses in these sectors. I can confirm today that 66 million of this will go to the hospitality sector, 8 million will go to the food and drink supply chain affected by hospitality cancellations, and that includes wholesalers. 20 million will go to the culture sector, 3 million to the wedding sector, and 3 million to the worst affected parts of tourism, including international inbound operators. We're working with councils, enterprise agencies and others to ensure businesses get this money as soon as possible. Those who've received support previously will be contacted directly, and further details of the funding and how it will be paid are available on the Find Business Support website. The support we are providing is significant, but I know it won't fully compensate these sectors for the impact they're suffering right now. That's why I wrote to the Prime Minister yesterday asking the UK Government to provide the support that is needed. In my view, business now needs the type and scale of financial support available earlier in the pandemic. And the reality is, whether anybody likes it or not, that can only come from the UK Government because it has borrowing powers that the Scottish, Welsh and Northern Irish governments simply do not have. I'll press this point with the Prime Minister when I speak to him later today. I had hoped that I would already have spoken to him by now because we must all realise that with a virus doubling every couple of days, businesses already bleeding, every 24 hours counts. There is no time to waste. So I hope the conversation later will be a positive one and that it will give businesses the assurance of support that they so badly need. However, to return to the point I was making earlier, the best way in the longer term to support businesses sustainably is to get the virus back under control. In that, our first and most important line of defence is vaccination. It seems very likely that Omicron is better than previous variants at evading, to a certain extent, the immunity conferred by 1 or 2 doses of vaccine. But more positively, it seems that boosters are still very effective in reducing the risk of falling seriously ill from Omicron. So getting a booster is an essential way of protecting yourself and others, and of course of helping relieve and reduce the burden on the NHS. The booster programme has picked up speed in the past week. Yesterday saw the highest number of vaccinations we have ever delivered in a single day. 67,016 first, second and third Jags were delivered, and of these 63,327 were booster and third Jags. Now let me just illustrate a bit more for you just how much faster the booster programme is now running. On the 25th of November, which is the day we first learned about Omicron, 32,500 boosters were delivered. Yesterday, as I've just noted, it was 63,327. That's an almost doubling of the daily rate. And most of that acceleration has happened just in the past week. In the past 4 days alone, more than 220,000 booster and third Jags have been administered across the country. I am so deeply grateful to everyone working so hard, and they are working exceptionally hard in vaccination teams across the country, and of course to everyone coming forward to get their Jags. More than half of the over 18 population has now had a booster, but we want as many people as possible to get boosted by the time the bells strike on Hogmanay. Online booking is open to everyone over 18. There's also additional walk-in capacity in many centres. So please, if you haven't had your booster yet, make arrangements to get it. If you already have an appointment, but it might not be till January, you can go online and reschedule it to bring it forward. And if you haven't had a first or second Jag yet, please get that. It's never too late to get vaccinated. That's important for anyone who hasn't been vaccinated, but I want to emphasise that point today for pregnant women. The JCVI yesterday added pregnant women to the list of priority groups for vaccination, underlining that it is the most important protection for any woman who is pregnant and, of course, their baby. The continued rollout of boosters is essential, but there's a key point I need to emphasise again to everyone today. No matter how fast we do it right now, in the immediate term, it won't be fast enough on its own to outrun Omicron, not least because the immune protection from a booster Jag doesn't kick in straight away. It takes around a week. So given that Omicron is doubling every 2 to 3 days, that means potentially we have 7 more doubling cycles between now and the end of the year. And given that case numbers are already high, that could take them much higher than anything we have seen before. And that would pose the most severe challenges yet for the NHS and the economy. So the serious message for all of us is this: yes, we must speed up vaccination, and as I've illustrated, we are doing that. But at the same time, we must also act to slow down the virus. That's why we've put a new duty on businesses taking effect today, backed by guidance to take reasonable steps to reduce transmission in their premises. That includes, for example, physical distancing and measures to control the flow of customers in supermarkets, and also support for home working. And it's also why we are asking all of us now to reduce as much as possible the number of social contacts we have with people outside our own household. If we do meet up with people, we should make sure there are no more than 3 households in the group, and we should absolutely make sure we're taking lateral flow tests before we go. But that's a safety net. My fundamental ask of everyone right now is this: in the run up to Christmas, stay at home much more than you normally would, and stay at home as much as you can. If what matters most to you is spending time with your loved ones on Christmas Day, and I think that's what matters right now to most to many of us, don't risk that by going out before then and possibly catching COVID. Because the reality is, if you are mixing with others just now, getting this virus is a real and increasing risk. COVID in this new Omicron form is circulating really widely just now, and it is very, very infectious, much more than previous strains. So if someone in your group, or even someone just in the same venue as you has it, your chances of catching it are much higher than with the Delta variant. So please try to stay at home as much as is feasible, and prioritise the events and the occasions that matter most to you over Christmas. And then after Christmas, if we all go back to limiting our contacts for a period further, we can hopefully then minimise any January surge in cases. I know all of this is really awful. It's awful for all of us. It's particularly awful for businesses affected right now. I think many of us are finding it even harder this Christmas than last year. I know that's the way I'm feeling right now. Just 3 weeks ago, I really thought we'd turned a corner and had a genuine prospect of a much more normal run up to Christmas. The emergence of Omicron really has been the cruelest of blows. So it's quite understandable that we're all feeling sad, upset, frustrated, even angry about this. And believe me, I am not immune from these feelings. But we should also, however difficult it is, try to hold on to hope as well. It might not feel like it, but we are in so much better a position now than we were this time last year because of vaccination. Every booster put into someone's arm right now is another brick in this wall of protection that I do believe will increasingly defend us against Omicron as we go into the new year. And second, although learning this has been a long, hard and very wearying lesson, we do know what to do to slow this virus down. And what we need to do is as follows. Firstly, get vaccinated. That really is the most important thing any of us can do right now. Second, test regularly. I'm asking everyone to stay at home as much as possible, but if you are mixing with other people, please test yourself before you go. And just before you go, if you're going out at night, don't rely on a test from the morning. Make sure you test yourself just before you go. If we do that, we significantly reduce the risk that we're inadvertently passing the virus on to others. Lateral flow tests are easy to take. They are easy to get hold of. Order them online, they'll be mailed to you, collect them from local pharmacies or testing centres. You can go onto the website, put in your postcode, and it will tell you where the closest collection point is. So please make sure you do that if you are going out anywhere. But finally, please do stay at home as much as possible. And when we do mix, as well as testing though, comply with all of the other protections. Face coverings on public transport, in shops, moving about in hospitality. Keep your windows open if you're meeting indoors. Not easy at this time of year, but really important, and follow all of the advice on hygiene, and of course work from home as far as possible. We really do, and there's no point in me sugarcoating this, we face a really difficult period again ahead. But if we do all of these things, limit our social contacts, get vaccinated, look out for each other, we will get through it. I am really grateful again for the way in which the country is responding, and it's obvious that the country is responding well. We can already see that people are listening to and following this advice. And given how hard it is, so much harder now than before, it underlines, I think, the sense of responsibility and solidarity that we all feel for each other. I hope very much that we will see the rewards of this in the period ahead if some of our worst fears don't materialise, but we do need to stick at it. So let's look out for each other and be kind to each other. This is probably a good time to drop a line to or ring up someone who might be feeling especially down or alone right now. And doing that might also cheer us up as well. The most important thing, in my view, that we've learned over the past couple of years is how much we need each other. So this is a time to pull together again and support each other in every way we possibly can. Thank you very much for listening. We're going to open up as normal to questions, and Gregor is here, of course, to give some further insight into Omicron and also to repeat and reiterate the advice we're giving people. I'm going to go first, though, to David Wallace-Lockhart from the BBC.
Thanks very much, First Minister. Given the picture you've just painted, is it wise that there'll be 50,000 football fans at Ibrox tomorrow and a similar amount at Hampden on Sunday? And what sort of daily case numbers would we have to see before, football fans might not be able to go to games? And secondly, can I also ask you, you're asking the UK government for more funding. Are you able to spell out what you want that funding for? Is it further compensation for the impact business is currently feeling, or do you want to go further with the measures that business are currently operating under, and therefore you need further money to compensate them for that?
I think that's probably pretty obvious. I want there to be support in place for the impact businesses that are already suffering, and I'll come back to that point in answering the first part of your question. But we also have to know right now, all of us, all of the governments across the UK, that we are not going to be curtailed in taking any essential steps to protect public health by a lack of finance. So there needs to be clarity and certainty on that. That doesn't mean that any of us want to be in the position of having to take those further steps, but I think having gone through this now as First Minister for 2 years. Boris Johnson has done the same as Prime Minister. The one thing we should all have learned is that in these moments we need to have the ability to act as we consider necessary to protect public health, and we need to have the ability to act quickly to do that. And that means that we should have the certainty that we can do that without the risk of pushing businesses into intolerable difficulties. Now, in relation to the first part of your question, my advice to people right now, and I can't be clearer about this maybe I could be clear, I'm going to try to be as clear as I can, is please limit your social interactions, wherever that your social interactions would normally be. Limit them as much as you can right now. I'm asking people, and I'm not doing this lightly after 2 years of this, I'm asking people in the run up to Christmas to stay at home as much as they can, and much more than people would normally be doing at this time of year. Now, had we the financial support mechanisms in place that were in place earlier in the pandemic, I would be more able perhaps to give straightforward advice to events, to say don't have these events go ahead right now. I can't do that when I can't compensate people. And that's what I'm saying. We need to get these financial mechanisms in place so that across the UK we can take the steps that we think are necessary. All I can do right now is ask people to modify their own behaviour. But that also has an impact on businesses, which is why we still need that financial support in place. So my message to everybody is think very carefully about every interaction you're having. Every time right now we go anywhere, we are at not insignificant risk of getting COVID. We are a week and a day away from Christmas Day. Any of us get COVID right now will be isolating over Christmas Day. So what I'm saying to you is, if you're planning to go somewhere, you have to make that judgment, but think about whether it's worth it to you to run the risk of not being with your family on Christmas Day. That is the toughest message imaginable, but that is what we are dealing with, and that is the advice I am giving people. Gregor, do you want to add?
So the way I would think about this, David, is the more interactions we have with other people, the more likely we are to come across someone who is already infected with Omicron. The more often we do that, the more likely we ourselves are likely to be infected by it. And what we know of this particular variant so far is that it is so much more transmissible than the previous variants that we've had to deal with, that if you come in contact with someone who has Omicron, or you're in the vicinity of someone who has Omicron, you're actually very likely to contract infection yourself. We know that household contacts, for instance, have 3 times the risk of contracting the virus and infection than we had with Delta. So people must use that information to form the judgments about how they then interact with others just now. It's true that we can reduce the risk by making sure that we're taking all the steps, such as testing any time that we come in contact with others. And people who decide to go to the football, as you've described, over the course of the weekend, whether they're vaccinated or not, I would encourage them very, very strongly to make sure that they're taking lateral flow tests before they go. And please, if you're symptomatic at all, don't go to the football. Don't risk spreading it to others. Don't risk spreading it amongst the coaches or the cars that you're going to be in going to the game. Because if there's someone with that infection on board the coach, it's very likely that others on board will contract it as well. So just think about the impact that you can have on others and how you can safeguard it. And absolutely critical to that is making sure that we're isolating whenever we have any of the cardinal symptoms, that we're testing as quickly as possible to make sure that we know whether those symptoms are down to Omicron or coronavirus, and that we're taking lateral flow tests in between those times just to make sure that we're not in that pre-symptomatic phase as well.
Thanks. Gordon Cree from STV.
Thank you. You've said that we're potentially at the start of a tsunami of cases. I just wonder whether that rise in cases has already been priced in to the advice that as of now, Christmas isn't cancelled, so that people don't need to worry that next week, if we do see an increase in cases, we're not going to be back here hearing that tougher restrictions have been put in place at that point when it's something that's already anticipated in terms of case numbers? And if I can also ask you, we've seen some people today again suggesting that a full lockdown is either necessary or inevitable. Is it? And can I ask Dr. Smith, with a rise in cases in the general population, that's inevitably going to mean that there are more people in hospital who test positive. Would it be helpful or useful to publish a figure for those who are in hospital for COVID rather than just those who are in hospital who have tested positive for it?
Yeah, I think we have published some information on that in the past, but I'll pass that to Gregor. Look, in terms of is a lockdown, nothing's inevitable in this. You know, it feels, and I feel it, I know everybody feels it, as if, you know, this virus is never ending, as if no matter what we do, it keeps coming back and punching us all over again. But we shouldn't be fatalistic. We know we can drive it down through behaviour, so let's not see anything as inevitable. There will be an extent to which some increase in cases is already baked into what we will see, because we know the incubation period. So some of the people who will appear in our test positive numbers over the next few days are already infected. It just will take a few days for them to become symptomatic and go for testing. So we will see that increase, but over the next few weeks we can all influence how high that increase will be. And everything we are doing just now is trying to encourage people to behave in a way that means we can all interact with our families on Christmas Day, and I'm not anticipating changing that. But we will have to interact with our families on Christmas Day, or we should interact with our families on Christmas Day in a way that is safer than we might normally do. Testing everybody that's going to be in a group, making sure everybody's vaccinated would be another piece of advice. Hygiene, windows, all of that is really important. But if we reduce contacts between now and then, we help make Christmas Day safer. And if we continue then after the sort of main Christmas celebrations, which for most people's Christmas Day, I know some people that'll be Boxing Day, but whatever that is, if you then limit your contacts for a wee while after that, we can help stop Christmas Day socialising, feeding an increase in cases afterwards. So that's basically what we're trying to achieve right now, but we need everybody to do the right things in order to get there.
The cases we announced today represent infections that occurred 5 to 7 days ago. That's really important. Now, since that time, with a doubling time of 2 days or thereabouts, just now just over 2 days, that represents 3 subsequent doubling times since that period. So, you know, there could be an 8-fold increase actually in the numbers of infections that are occurring today compared to when those infections that we announced took place. That's a really important thing to understand in terms of the exponential growth that we're seeing just now, and we factor that in. But we are not powerless to stop that, because people's behaviours have already begun to change in response to that, to the announcements we made earlier on this week. We know that people going for their boosters, by limiting the contacts that they have, by making sure they're taking those extra precautions, testing frequently, getting themselves out and isolated early so that we can break those chains of transmission, are the most likely things that are going to stop that spread of infection and make sure that that 8-fold increase doesn't happen in the real world that we see just now. Now, in terms of the data is all important just now. We need more and more data to understand exactly the impact and the characteristics of this new virus. Unfortunately, it's still going to be some time yet before we fully understand the severity of the disease that's associated with this. But what we're looking at is how we can develop the most up-to-date data as quickly as possible that recognises that it's important to differentiate in real time the contribution that's made from people admitted to hospital because of an Omicron infection, or people who have contracted it but are admitted for some other reason. And as I say, that work is in place just now. Public Health Scotland are working with analysts and health boards to see exactly how we can develop that as quickly as possible.
And Public Health Scotland did that analysis pre-Omicron for earlier COVID cases, where they broke down the in-hospital with COVID from in-hospital because of COVID. So that work is obviously important in relation to Omicron too. James Matthews.
Thanks, First Minister. Just going back to your answer to David, you spoke about the financial mechanism having to be in place. If, when you speak to Boris Johnson, he says what you want to hear and there is money on the table, there are resources for further restrictions, can we assume there will indeed be further restrictions, cancellations possibly, and specifically, would that include Edinburgh's Hogmanay party?
No, you can't assume anything. I will continue to take decisions that I think are appropriate, and I'll be able to take decisions that I think are appropriate without worrying about not being able to compensate businesses. Ali Kizat from ITV Border.
Obviously, your advice to limit social interactions and stay at home isn't quite the same as England. So if people are having families over for Christmas and the run up to Christmas, what's your advice for them? And also, if we're likely to see people coming over from the border to come shopping or spend time with their families, are we likely to see then a Christmas spike following the holiday period?
Look, we're not able to completely, through behaviour, control this virus. People get infected with it sometimes despite their best efforts. But we know from previous experience, if we all do the difficult things that we're advising right now, we can suppress and drive down infection. So I keep making this point. We're in a really tricky place again, but we're not powerless. We can, if we do these things, try to bring a downward pressure to the infections we might otherwise see if we all just kept behaving the way we have been in recent weeks as things started to get back to normal. And I think we're seeing that behaviour change already, and therefore I hope already we're starting to have a positive influence in what might otherwise have been the case in the weeks to come. But we need to stick at it to make sure that's the case. In terms of people in Scotland, whether you're in Scotland because you live here or whether you're visiting Scotland over Christmas, the advice you should be following is the advice of the Scottish Government while you are in Scotland, and that is to, in the run-up to Christmas, to limit your contacts as much as possible. If you are mixing, to limit the number of households to 3, to test before you go anywhere, and to do the same after Christmas so that we avoid any impact of the core Christmas celebration activities. And that's my advice. It's for other leaders to give the advice they deem fit. It's for me to give the advice I deem appropriate for Scotland. But when I listen to the Chief Medical Officer of England, Chris Whitty, I think what we're saying and what he is saying is pretty similar. And I would therefore just encourage people to think about why we're saying these things, what the purpose of it is, and follow that advice as much as you can. Gina Davidson from Global.
Thanks, First Minister. Can I ask, you've laid out how you're going to spend the 100 million that you have found out of your own budget. Do you have any idea how you're going to allocate this 220 million when it comes from the UK government, where that is likely to go? And do you think that the Prime Minister is not taking Omicron as seriously as the Scottish Government, the Welsh Government, and even his own medical advisors?
On the first point, Gina, I did a lengthy interview with you the other day where I kind of set out the issue with the 220 million. There is no extra additional 220 million coming to us. That is the problem. We had already budgeted for 268 million actually, that through, I won't go into the technicalities of the budgetary flows, but that 268 million was already budgeted for in what we're planning for the start of next year. And what became quickly obvious after the Treasury announcement was that it was that money they were asking us to bring forward. So it's not additional. If we're going to spend that now, we'll have to work out how to fill the hole in January. It's not additional money. But then what became obvious the day after that, which is even worse, is that where we thought it had been 268 million, the Treasury is now saying it's just 220 million. So we have and I know this will sound, and in different contexts it might be fair to say this, that I'm making a political point. I'm not. This is just facts. That Treasury announcement, and I'm sure this wasn't the intention, or I hope this wasn't the intention, but inadvertently or whatever, maybe just didn't pay close enough attention to it, that Treasury announcement has actually left the Scottish Government worse off than we thought we were before it was made. So I have no extra money to allocate as a result of that Treasury announcement. That money was already factored in to our budgetary considerations, which is why we need to get to a position, and it's more fundamental than just wee pots of money that might or might not be real every now and again. There has to be a systemic approach to this, where we know that if we have to take difficult public health decisions, the support kicks in behind that, and it kicks in whether it's Scotland, Wales, Northern Ireland or England making these decisions, and not just as is the case just now, only when England, the UK government for England, takes those decisions. So hopefully we'll get some progress later on when I speak to the Prime Minister. Look, I think that's a question you'd have to put to Boris Johnson. I can only speak for myself. I am taking this extremely seriously because I think it is a really serious threat right now. I know the others in the UK government. I listened to, as I say, Chris Whitty and others, and there is definitely a seriousness there. I heard Mark Drakeford's comments about measures in Wales. So we're all taking this seriously. We might have different views on what the right things to do are, but there's no alternative but to take in steps right now to mitigate the risk we face. Otherwise, it will overwhelm the health service and it will cripple the economy. And it's not a choice between the two. We've got to stem the Omicron infection wave, or both of these things will happen. Do you want to add anything, Gregor? Okay. Callum McQuaid from Bauer.
Thanks, First Minister. We've seen quite a few big concerts cancelled in Scotland this weekend by the organisers because they feel it's not right that thousands of people should be gathering together in these settings. Why are you leaving that decision to them?
I think I've probably answered that question pretty brutally already. I don't have the ability to compensate events. If I did, I would love to, as I have tried to do. Not love, that's the wrong term in this context. I hate every part of this. But at every step of this, I've tried to give the clear advice. Obviously, individual judgments matter here, but I've tried not to leave the onus of deciding this on the shoulders of individuals. I've tried to make sure that the government is giving clear advice. And earlier in the pandemic, we knew that if we were telling a business to close or an event to cancel, there were financial mechanisms that would kick in to provide support. That's not the position just now. I can't say to a concert cancel because I can't then ensure the financial support to compensate it. If I could do that, and maybe after my conversation with the Prime Minister we'll be in a different position, I would be able to give clearer advice to events and to businesses. Right now, all I can do, because I can't do nothing in the face of the Omicron threat, so all I can do is say to people, be very careful about your interactions, and all of the advice that I've already given. But I know that too has an impact by default, the same impact by default on businesses, which is why we come back to this, inescapable fact here. The UK government has to get its finger out, it has to step up, and it has to provide this support. Because this is an impact, even although the Prime Minister's messages might not be the same as mine here, people in England are changing their behaviour responsibly, I think. And so we're seeing the same impact on hospitality in England as we're seeing in Scotland. There needs to be, I don't know when the Chancellor is back in the country, if he's back in the country, but he should have no other job today but to get in place the financial support mechanisms that help hospitality, culture and the wider economy as we go through this next difficult phase, because the costs of the consequences of inaction right now is that this next difficult phase will be much, much harder and much worse than it would be if we manage this properly right now. Neil Pooran from PA.
Thanks, First Minister. For both yourself and the CMO, are you keen to see the list of coronavirus symptoms which would require a PCR test updated? The Zoe app is recording a lot of Omicron cases which appear similar to a cold, so people are having headaches, sneezing and so on. And if this list of symptoms is updated, are you expecting a surge in demand for PCRs, and are you prepared for that surge?
Well, it's a clinical question. I think it's better that I would only ever answer it as a politician, and my answer just now is if you've got symptoms that you worry might be COVID, go and get tested, would be my advice. I know the CMOs look at the case definition on a regular basis, so I'll hand over to Gregor.
Thanks, FM. Yeah, I mean, the case definition is reviewed on a regular basis. It's the UK Health Security Agency who leads on that work and presents their findings to the CMOs. We discuss it. And what they're looking for is the predictive value, the sensitivity and the specificity of different symptoms and symptom combinations that predict the likelihood of a positive test. Now, at this time of the year, when we've got lots of different circulating viruses, and believe it or not, coronavirus isn't the only circulating virus that we see just now. It might not even be the most common virus that we see just now. It's really important to be able to differentiate what symptoms, cluster of symptoms, allows us to positively predict the positive test most accurately. That's kept under regular review. I spoke to Jenny Harris, the Chief Executive of UXA, earlier on this week, and that was something that they were going to undertake fresh review of again as we develop more knowledge about Omicron, and subsequent to that, if there's any change in the formal case definition, then that will follow. But as the First Minister has already said, if people feel that they are unwell and they've got symptoms which they are concerned may be Omicron, my advice to you is to get tested just now. Don't wait. Go and get tested. Isolate until you've got a result, and make sure that you're not spreading on that infection to anyone else.
Thanks. Michael Blackley.
Thank you. Good afternoon. Do you agree with those in the hospitality sector that say that what they are experiencing just now is lockdown by stealth? And you've announced £66 million of support for them, which I think will amount to a few £1,000s per premises. Is that really enough to help them? Can you not find any more in the budget that you're currently putting through Parliament? And also, if you can't find any further funding at the moment, is there anything else that can be done to help, such as helping them with the impact of self-isolation for staff? Could you cut the requirement for self-isolation?
Yeah, that would really help, because that would spread infection even further, and that would be not doing any favours to businesses. I don't know if you've listened to a single word I said, Michael. I don't think it's enough, but we found £100 million out of a fixed budget, having to take that from elsewhere. If we have to do, and also we found an additional £100 million to help with self-isolation payments. But every penny we now take, I don't know where you think I should take it from. The health service, the education budget, the justice budget. We don't have, when the UK government makes these schemes available right now, they're not taking it from any of these budgets, they're borrowing it. If I had the borrowing powers the Treasury had, I would be able to do that. And it's a sensible thing to be doing right now to help shield the economy from the pressures of this. I don't have those borrowing powers, so I can only look to the Treasury to use them, and it will be unconscionable, frankly, given what we're facing right now, if the Treasury doesn't very quickly start to use these things. So that's the position. It's not a political statement I'm making, it's a statement of the funding arrangements that are in place in the UK right now. The First Minister of Wales is making exactly the same points. The First Minister of Northern Ireland, hardly somebody of a nationalist sort of mindset, is making exactly the same points right now. This is just a feature of how funding in the UK works, and I think even for the Daily Mail that should not be impossible to get your heads around. Elsa Maishman from the Scotsman.
Thanks, First Minister. The BMA said yesterday that the public should not be expecting anything other than urgent care from the NHS at the moment. Is that your view as well? And you've just spoken about the risk of the NHS being overwhelmed. What exactly does that scenario look like, given we've already seen long waiting times and non-urgent surgeries being cancelled? And just finally, when does your modelling predict that all cases in Scotland will be the Omicron variant?
So I didn't hear that last bit of the question.
Just on your modelling, when do you expect that Omicron will take over as all cases in Scotland, as opposed to the 50% that you announced today?
I'm not sure exactly. That will just happen progressively now, and we'll see that over the next days. I will check the modelling later on to see whether we've predicted a day, but it's not something that's set in stone. Last week, for example, we might have predicted in our modelling that we would get to 50% earlier this week, but our modelling becomes more accurate as the experience of the spread of the virus becomes more developed. But increasingly from now on, we can all help slow that down by what we're doing. So the behaviour change we're seeing will help slow it down generally, will help slow Delta down as well, because we've still obviously got almost half the cases are still Delta. So none of this is set in stone. In terms of the question about overwhelming the NHS, I hope we don't get there, because that is, not a position anybody wants to be in, and that's what we need to try and stop. The NHS not being able to cope with the number of admissions. The NHS is doing absolutely heroic work every single day right now, and we need to support them. Urgent care is always prioritised, but the more we can exert a downward pressure on COVID cases, the more we can minimise impact on non-urgent care as well. And anybody who hasn't seen it already, I would recommend going on to social media and seeing a clip from Chris Whitty yesterday, taking on this idea that urgent care for other conditions was being deprioritised because we were wrongly prioritising COVID. That's not the case. COVID patients are going to end up in hospital whatever we do, but if we don't try to control COVID, there will be more of them, and that is what is disrupting other care. So we need to get COVID cases down in order to allow the NHS to operate as normally as possible.
So I think the First Minister's dealt with the first part of your question, but let me try to expand a little bit on your modelling question just now, because there's still a number of variables which are absolutely critical in understanding what happens from here with Omicron. And some of that is about the degree to which it shows vaccine or immune escape, the degree to which it causes reinfection, therefore, and also the patterns of transmissibility as it coexists with Delta. There is a scenario where Delta and Omicron could coexist together, and it doesn't wholly replace Delta. But what we're seeing from real world evidence just now, with particularly London, which is just ahead of us in terms of the epidemic curve that we're seeing just now, is that over the last couple of days we're starting to see, rather than Omicron being additive to Delta, that it's actually replacing Delta now as well. So we'll continue to track that over coming days, and as we understand more about these other variables, we'll be able to start to predict whether Omicron is going to wholly replace Delta or the two of these will coexist together.
Simon Johnson.
Sorry, First Minister. Sorry, just check on that second question. Was that you agreeing with the BMA that only urgent care can be
I haven't seen the detail of the BMA comments, so I've answered the question as I wanted to answer it. Thanks. Simon Johnson from the Telegraph.
Thank you, First Minister. Yesterday you wrote to the Prime Minister warning that you believed that further restrictions on the operation of higher risk settings may now be unavoidable. I just wondered if you could specify what settings you were referring to and what restrictions you were referring to. And secondly, just really following up some of the previous answers you've given, is it the case that if the Prime Minister gives you the sort of financial welly that you're asking for, that events like this weekend's Scottish Cup final, or pubs for that matter, wouldn't be happening because you'd be minded basically to close them down and compensate the operators? Thank you.
I'll take decisions as I think they are appropriate based on the data if we have the financial support. So I'm not going to pre-announce decisions that we haven't taken yet. Obviously, if the financial support's in place, coupled with the data, we'll continue to take decisions that we think are appropriate and necessary. On the first of your questions, I think after 2 years, the answer to that is probably quite obvious. Higher risk settings are indoors, poorer ventilation, people coming together in sort of small crowded places, often with alcohol involved. These are the kind of areas that we know. It's not a judgment on these sort of settings, it's just how this virus transmits. I don't want to be restricting or closing down anywhere, but I can't magic away this virus. I know what we need to do to try to curtail its spread, and I know what we need to encourage other people to do. This is a really difficult position because I don't right now have the financial wherewithal to compensate people, but nor can I in good conscience not advise people of the risks that we are facing right now given the spread of Omicron. So, maybe when I've spoken to the Prime Minister earlier on, I'll have more detail to add to that. Dan Verse from The Sun.
Thank you, First Minister. We're not seeing hospitalisation numbers increase just yet, despite the high case numbers and Omicron being around for, I think, about 3 weeks now. At what point do you expect it to rise significantly, or is there some hope it won't spike as dramatically as feared? And just on financing, it seems the Welsh Government have found the money to support the closure of nightclubs. Will you do the same?
I'm not sure I genuinely am not sure, because I haven't seen the detail of whether the Welsh Government has announced money for nightclubs. Well, fine. I've put £100 million into trying to support hospitality businesses right now, which I'm not sure if the Welsh Government has done. Look, we are maximising the support we can provide. I'm not going to repeat all of the reasons why we can't do more than that. I think to most people hearing this, it will be pretty obvious. We can't borrow the money, and that's all the UK government does. They don't take it from the health service, they don't take it from the education system. If we were to find more money, that's what we would have to do, because we don't have the borrowing powers. They hold these borrowing powers on behalf of all of us. It's not their borrowing powers, they exercise them on behalf of all of us. In relation to your first question, again, there is a well-known, after 2 years, time lag between, Omicron emerged about 3 weeks ago, but it has, not been... I think 3 weeks ago it was a tiny 1% or less than that of all cases. So as it increases and as you add that time lag, I would expect we will see hospital admissions rising. There was a slight rise in hospital admissions in the most recent week that we've got full data for. I think more instructively, London right now, which is a bit ahead of where we are on the transmission, is seeing quite a sharp, Gregor might want to say a bit more about this, sharp increase in hospital admissions. What will be if you remember back to, the spring, summer, where we talked a lot about Delta, although it was more transmissible than Alpha, had a lower percentage of cases going into hospital, largely because of vaccination by that point. We don't yet know what the percentage of Omicron cases needing hospital care will be. But say, for argument's sake, and this is purely as an illustration, with a virus doubling every 2 to 3 days, so much more transmissible, even if it was half the percentage going into hospital, the overall absolute number of hospital admissions would be vastly higher than what we've seen in recent times. That's simple arithmetic, which is why we need to bear down on the overall number of cases.
Dan, when you think of this, there's a well understood sequence of events that happens after someone comes in contact with someone who's infection. If they're going to become infected themselves, they'll tend to test positive between 5 and 7 days on average later. And they would then, if their condition was going to require hospital treatment or hospital care, that would tend to occur on average around about day 17. So that's a well understood sequence of events that has been shown to be relevant over waves 1, 2 and 3 so far. And so we're far too early at this point in time really to understand exactly how Omicron is going to behave and whether it's likely to be the same and what impacts that will then have on hospital admissions. When you think about it, it's only 14 days ago, less than 14 days ago, it was less than 2% of the cases in Scotland were Omicron. It's very, very small numbers and tended to be a much younger age group who were becoming infected as well. So for instance, the most common age groups that we're seeing this in just now are 20 to 29, followed by 30 to 39 and then 40 to 49. The characteristics of these age groups means that they are less at risk of hospital admission than older age groups. And it's only when we see how Omicron behaves in the whole population that we'll begin to understand exactly what impact that has on disease severity and on hospitalisation. Now, it's likely that we will begin to see an increase in hospital admissions. If we're going to see that over the next 2 to 3 weeks, that's probably about as broad as we can say it just now. And once we've got sufficient numbers of people who have been admitted to hospital, that will allow us to be able to assess and make a judgment and calculation on the risk analysis in relation to Omicron and severe disease. But unfortunately, it takes a number of patients to experience that pathway before we're able to get information that we're confident of using in that sense. So, 250 to 300 patients probably would give us a rough reckoning of it, but 500 patients in that pathway to really be more confident about the impacts of it.
Thanks. Mark McLaughlin.
Good afternoon, First Minister. I'm going to read a quote from Michael Bergson, who's the owner of Bucks Bar in Thundercat in Glasgow, and he said he lost 4,000 bookings over the weekend after the announcement on Friday. He said, "We've had 3 staff who had mental breakdowns in the first lockdown. I know 2 friends in the industry who have taken their own lives over this. So we know the risks and the harms of isolation. We don't know, according to today's modelling report, the risks and harm of Omicron. So can you just explain why you're risking known risks for an unknown risk? What's the balance there that you're striking?
Oh, I'm sorry, Omicron is not an unknown risk. We might not know everything.
The report it is.
Well, I'm sorry. We know if we've learned anything over the past 2 years, COVID is not an unknown risk. COVID sends people into hospital. It has taken the lives of around 10,000 people in Scotland already. Of course, it's not the only risk we face, but we don't reduce those other risks by allowing COVID to run unchecked across our population. On the contrary, I think we would exacerbate those other risks if we did that. So we've got to keep COVID under control, particularly when we know we have a variant now that is more transmissible and capable of infecting many more people, perhaps reinfecting people who've already had it, and also evading some of the vaccine immunity. I would, as the sort of person who carries the can in Scotland for all of these decisions, I would love it to be as simple and as binary as we'll do this and there'll be no risks over here, or we'll do the reverse and there'll be no risks. And it's not like that. It's really not like that. COVID and what we have to do to control COVID has caused a lot of harm elsewhere. I really understand that. But to go from that to arguing that not taking steps to control COVID would avoid all of the other harm, I just think is a really dangerous argument, and it would not be borne out in reality. This is a tough situation for everybody, and we've got to manage our way through it, just as we have for the past couple of years. Caroline Wilson from the Herald.
Good afternoon. We've already seen an example where a cancer patient's surgery was cancelled 3 times due to lack of intensive care beds at Ninewells Hospital. Can you give some assurance that urgent cancer surgery will go ahead?
Urgent cancer surgery generally has always been prioritised. Every person who has their treatment, particularly if it's for something as serious as cancer, delayed, postponed, affected in any way, that is a really serious thing. I'm not suggesting it's not. But I would encourage you to go and watch Chris Whitty before the House of Commons committee yesterday, articulating this point much better than I can. The idea that if we just stop worrying about COVID means that all of that goes away is just fundamentally wrong. If we stop trying to control COVID, we will have more COVID patients in hospital than we do just now, because people will get ill with COVID and they will need hospital care. So there will be more of them, and that will have a bigger impact on non-COVID care. It's the virus, not the protective measures, that are causing these problems. And it's the virus we've got to control and get back on a downward path. That's difficult. The implications of how we need to do that are horrendously difficult, but it is inescapable. And I take no pleasure in saying that, but it is the case. And my job is to try to explain what we need to do, to explain why we need to do it, and to help us on a path that allows the NHS to get back to a situation where it's not having to postpone or delay or interrupt in any way the non-COVID care that it is doing. But simply stopping trying to control COVID would be the worst possible thing we could do in order to achieve that outcome.
I would put it very, very simply. The surest way that we can make sure that we can continue to prioritise cancer care or any form of urgent care is to make sure that we're suppressing the coronavirus infection, whether it be Delta or Omicron, as much as possible. It is the growth in that infection and the way that that then knocks on to the way that we are able to deliver healthcare and people that require admissions to hospital that impacts on the ability to be able to provide that urgent care. And really the single most important message that I can give to everyone is that we can all play a part in making sure that we can keep those infection rates in our communities as low as possible. As I've said before, we're not powerless in this, by going for your booster, by making sure that we're vaccinated, by wearing face coverings in indoor settings, by testing regularly before we're meeting others, by reducing our contacts, all these things that we've become used to allow us to influence the overall level of coronavirus infection in our communities, and therefore make sure that my colleagues are able to provide the care that they want to provide to other people.
Thanks. And that's the other thing that happens if we don't try to control Omicron. More people get it and more people are off work. So there'll be fewer health service workers to deliver the care that is needed. I understand the desire we all have. I'm, again, not immune from this, of wishing there was some sort of straightforward magic way through this that we just hadn't realised before. There's not. We need to do the things that we have needed to do for the past couple of years to try to get this under control. And we are in a better position than a year ago. So I'll end, because that's all the questions, I'll end thanking Gregor and the journalists and Robert for our BSL interpretation, but just reminding people, firstly, if you're over 18 years of age, please get boosted. So go on to the NHS Inform website. If you haven't done so already, book a booster appointment for it as quickly as you can. The more people we get boosted by the end of this year, the more that wall of protection will help us as we go into the new year. If you haven't had any of your vaccinations yet, please get them. It's not too late. Secondly, and this is really hard for all of us, please reduce your contacts with people in other households as much as you can just now. Stay at home as much as you can, as much as it's possible for you to do. And think, particularly in the run up to Christmas, every interaction you're having could give you COVID. So is it important enough to you to take that risk of then perhaps losing the opportunity to be with your family on Christmas Day? Anything you are doing, please make it as safe as possible. That means testing yourself before you go. Made a point earlier that I want to repeat here. Test yourself just before you go. Don't rely on a test taken in the morning for something you're doing in the evening. You can get tests in all the ways I've already set out. Make sure that you're limiting the number of people you're seeing from other households. So keep it to a maximum of 3 households represented in any group that you feel you have to be in over the next few days. Wash your hands, wear your face covering when you're in the indoor public places we talk about, and keep windows open if you can. So it is about get boosted so that we build that protection, limit your interactions, and any interactions you feel you have to have just now, make them as safe as you possibly can. Thanks so much for listening. I know this is not anything anybody wants to hear. None of us want to be in this position, but we need to pull together again to get through it by doing all of the things that we know from experience make a difference. We will keep you updated over the weekend and into next week. But in the meantime, thank you very much for everything you're doing.